Hey guys, it's Dr. Anthony Davis at the Davis Medical Group in East Texas. Today we're going to talk about another one of my favorite nutrients, and that's going to be magnesium. Magnesium is so important for your muscles and your bones and your nerves, and it can get off, and it's very difficult to measure. So if you like this video, give me one of these, a nice big thumbs up, click down there. More importantly, please subscribe to this channel. That's how we grow. It's how we bring you more and more quality videos. More coming now on magnesium. So magnesium is a mineral, and it's found all over the place. In the human body, it primarily lives inside the cells. So when you check the blood level, it can be very difficult to determine whether or not you have enough. And so it's often we use the measurement in the bloodstream, but clinical signs are also very important. So it's a mineral. And what does it do? It does some very, very, very important things in the body. Cellular energy production and storage. Well, how important is that, right? That's how your body has gasoline and fuel and energy to move. Cell growth and reproduction of cells. How do you make new cells? You got to have magnesium as a cofactor. Over 300 different enzyme reactions require magnesium. It's so crucial. Protein and DNA synthesis. Well, that's what you're made out of. The process of making a protein is a very fascinating thing. It uses DNA and RNA sequences to fold and manufacture these complex structures, and magnesium is important for that. So we have cellular energy, cellular growth, cellular reproduction, protein synthesis. It blocks neuromuscular transmissions. You know, it's interesting, if you don't have any blockage of the signal from your toe to your brain, it's too loud, it's too strong. And magnesium goes in there and tempers that so that you can have normal reflexes and normal nerve function. Without the magnesium, you lose that ability. So you have chronic pain and a lot of chronic issues that come from chronic muscle issues when you have the ability to block those transmissions. There's a charging mechanism in the heart. So you think of a battery, it has a positive and a negative end. Well, that's how the heart works. It channels a sodium-potassium exchange pump from the blood to the inside of the heart cell, and that's how you build up this electrical charge, and magnesium runs that. So if you don't have magnesium, you can't have that nice charging mechanism in the heart, and you have significant cardiac issues. So magnesium is so important. So let's start with low magnesium, because that's what we're primarily going to talk about. And so what are the symptoms of low magnesium? Classically, it presents with like anxiety, migraine, headaches, chronic pain. But clinically, you can see cardiac arrhythmias, you can see difficulties with the heartbeat, you can have a V-fib that's impossible to shock. You shock somebody and their heart won't stop fibrillating. You can have a loss of appetite, nausea, fatigue, weakness, dizziness, difficulty swallowing. It's important to know that there's a ton of symptoms of low magnesium, and they can often be quite impressive. And you can have things like vertical nystagmus, where your eyes bounce this way, not this way. Normally this way is pretty common, but when the eyes bounce this way, it can certainly be a magnesium thing. You get rigidity in your muscles and heart arrhythmias, and you have things like that that you can see. But in my mind, in my clinic, the number one thing I always see is muscle spasm, a muscle cramping. If somebody tells me I have muscle cramping for years, we would just say, you probably need some potassium. No, it's generally a magnesium problem. So my gut reaction and my initial recommendation will always be, you need to take some magnesium. And that helps muscle cramping more than anything. It does it a lot of ways, but one of the ways it does that, it actually helps you absorb the potassium. So we don't really treat it with potassium like we used to. We treat it with magnesium. Well, it's much less common to have high magnesium, but it does happen. And you can get similar symptoms in that the muscles are also affected, but muscle weakness, headache, increased thirst. You see that a lot with high magnesium. And a lot of times high magnesium can lead to difficulties with your body responding. Reflexes go down, your blood pressure goes down, your breathing goes down. Too much magnesium really weighs the system down, and it just cannot create the charges that it needs for the body to function properly. So high magnesium is equally as bad to low magnesium. It's just not near as common, because typically the way you get high magnesium is you overdose on magnesium. Kidney failure can do it as well, but primarily you get it from overdosing on magnesium with milk of magnesia or antacids or Maalox or things that contain a lot of magnesium. And but certainly kidney failure, respiratory failure, thyroid disease, adrenal insufficiency, and tissue breakdown. You know, I mentioned a while ago that the primary storage in your body of magnesium is in the bone, And if I didn't mention, and so, but it's also in the inside the cells. So when you have tissue breakdown, whether it's from dying cells or injury, you release a ton of magnesium, and that can overload the system with magnesium and give you a temporary high magnesium level, which then leads to the symptoms we mentioned. So we mentioned high magnesium temporarily. We're going to focus back on low magnesium. How do you get low magnesium? Obviously, if you don't eat things that have magnesium in them, and I'll list those in just a second. If you don't eat things that don't have magnesium in them, then you're going to have low magnesium. Alcoholism, starvation, protein, calorie malnutrition, which is not eating enough, all of those things lead to potentially low magnesium, which are important ways of fixing that. You could have decreased absorption. You could have a problem with your stomach lining or your colon lining. You could have celiac sprue or Crohn's disease, malabsorption, where you don't absorb it. You could have GI losses. You know, a lot of times you get put in the hospital and we stick a tube down your throat and we just suck on your tummy a lot to make your tummy feel better if you have a problem. We don't want any fluid going through the stomach, so we suck it out. Prolonged gastric suctioning can decrease your magnesium pretty dramatically. Overuse of laxatives can make you poop out too much magnesium, and then you get hypomagnesium that way. And it's severe diarrhea, the same concept. If you have chronic GI losses, you can also have increased losses through the kidney. The kidney is challenged or charged with maintaining most of your electrolytes. And if you have overuse of diuretics or you have too much calcium, your body will waste the magnesium to dump the calcium. Any kind of acute kidney injury, renal tubular acidosis, tubular necrosis, all these weird kidney names can certainly lead to magnesium wasting, and chronic renal failure certainly can lead to it. So renal disease. Pancreatitis can make you lose it. You can have multiple transfusions. When they give blood, they put citrate in there to make it not clot, and that can really chew up the magnesium. So you have a lot of transfusions. That transfusion is coming with no magnesium in it, or almost no magnesium, and so multiple transfusions can really wipe out your magnesium level. And endocrine, too much thyroid, too much parathyroid. Those can all do that. If you have diabetes and it's not properly controlled, that can certainly cause you to have wasting of magnesium. There's a few different medicines. They're mostly chemotherapy medicines or anti-rejection medicines, and so we're not going to talk about that. But if you are on chemotherapy or anti-rejection medicines, be sure and talk to your doctor about that. So moving forward, we're going to talk about what foods, how do you get magnesium without just taking it? How do you get it? Where do you get it from? My initial taking of magnesium for my own body was when I became a carnivore. We talked about that at a later time. I was keto for a long time and then carnivore. And at that point, I realized that the two major things that I wasn't getting from my foods was magnesium and potassium. So I started taking magnesium and potassium as part of my basic supplementation regimen, and it really made me feel a whole lot better. Food sources come from a lot of plants for that, nuts and seeds and greens and whole grains. Well, my diet, I don't eat any of those things, so I wouldn't get them at all. But nuts, almonds, cashews, and beans like black beans, you can get it from avocados, you can get it from bananas, basically plants that I listed. But there are some meats, particularly halibut and salmon. Halibut for sure has a lot of magnesium in it. So if you have a big meal with halibut in it, you're probably pretty good that day. You don't need to take any extra. But unless you eat halibut every day, as far as a meat eater goes, I'm a meat eater. So for me, if I'm not eating halibut, I probably should be taking magnesium. Broccoli, carrots, bananas, beans, lentils, all these sources. So meats, the primary meat, salmon and halibut. Halibut primarily when it comes to plants, nuts, almonds, and cashews. And then when it comes to plants, greens, leafy greens, like chard and spinach. And we're talking about, as it goes down the line, avocados, bananas, and then broccoli and carrots. Those are your sources of magnesium. So classically, what is a patient going to look like? Well, they're going to have things like PMS. They're going to have things like migraines. They're going to have muscle cramping. They're going to have muscle weakness. They're going to have heartbeat problems, cardiac arrhythmias. These are the kind of things that are going to trigger my concerns. If I see eye bouncing up and down, I'm going to start thinking, maybe there's something going on with their magnesium. If they've had significant tissue injury, I'm going to be certainly worried about the magnesium jumping up. And so it's really just thinking about magnesium a lot of the time. Well, I do a blood test and I see a magnesium of 2 or some kind of middle range number, but they have symptoms of low magnesium, particularly muscular symptoms. I'm going to be thinking magnesium, magnesium, magnesium. So I'm not scared to replace it. I want to replace it. So what am I going to replace it with? So what am I going to replace it with? I particularly like magnesium glycinate. Why? Because it's got glycine in it and it doesn't have anything else. Glycine does a lot of good things for you as well. So we'll talk about glycine at a different time. I take magnesium glycinate. It's about 300 to 400 milligrams for women and about 400 milligrams for men nightly. Particularly take magnesium at night. It's calming, relaxing, and helps you get better sleep. And I wouldn't think of magnesium glycinate particularly affecting the bowels. Now, if you're prone to constipation, this will be a good time to switch over and use magnesium citrate or magnesium citrate. Why? Because magnesium citrate does have a positive effect on your bowel movements. You have more of them and they're softer. And so if constipation is an issue, then magnesium citrate would be a better example. There's also magnesium oxide, which I would consider relatively neutral. I would consider the doses pretty similar across the board, 300 to 400 milligrams nightly for magnesium replacement. Certainly you don't want to be just throwing magnesium around, and probably get your level checked. So make sure you're not high. That's the most important thing with magnesium replacement. But this advice is just general medical advice. I'd like you to make sure that this does not trump or replace seeing your doctor. It's important to know that you have blood tests that should be done. This is advice and general recommendations, but get your levels checked. See your provider, then figure out what you should do about your magnesium. Well, surely there's some people who should not take magnesium. Yes, there is. There's a condition called myasthenia gravis. Myasthenia gravis is something where if you have it, you don't want to just be going around replacing your magnesium. It's important to realize that that's a reason why you shouldn't. And people with impaired kidney function or bad kidney function, you don't want to just be throwing magnesium around willy-nilly. You want to check it and do it under the supervision of a medical provider or your physician. So to summarize, if somebody comes to my clinic and they're anxious and they have poor sleep and they have poor muscles and they have migraines and they have PMS or they have constipation, I'm going to be thinking, this person very well could have a magnesium deficiency. So when I give them magnesium, what am I hoping to bring them? Here's a list of the things that I'm hoping magnesium replacement will give them. Stronger bones, less anxiety, more calmness, promoting of their sleep. I think that the glycine particularly gives you better calming than the oxide or the citrate. Because of the glycine, I want better sugars, I want better heartbeat, and I want to decrease PMS. You can also, as a side benefit, there are medical studies that show you get less fibromyalgia symptoms, better fibro symptoms, less chronic fatigue symptoms, and even a decreased risk for stroke or heart attack, or heart failure, and particularly also a decreased risk of diabetes. So magnesium is important. It's not something to dismiss. I've included magnesium, vitamin D, and vitamin B12 videos because I think that they're important, or maybe that's the ones I'm taking, and I want to make sure that we know that those are the fundamentals for most people. You know, it's up to 60% of Americans are low in vitamins, including magnesium as one of them. Does that mean everybody should be taking them? No, it depends on your diet. It depends on what you're doing. It depends on your symptoms and your body and your genetics. But it's important to think about them. So this guide will give you all you need to know about magnesium. If you like this video, give me one of these. Subscribe. I can't tell you how important that is for me. Growing this channel leaps and bounds. Dr. Davis, East Texas. Have a great day. Thanks.